Alzheimer's is rising fast, but a cure isn't just about science anymore. New breakthroughs depend on more than labs. Your future might rely on this shift. Alzheimer's disease affects more than 55 million people globally, and that number is growing as populations age. It accounts for about 60 to 70% of all dementia cases. The sheer scale has pushed pharmaceutical companies like Biogen and Eli Lilly to invest billions in research. But despite these investments, a definitive cure remains elusive. This crisis demands more than just lab breakthroughs. It requires a holistic approach involving healthcare systems, policymakers, and community support to truly make a difference. In recent years, several promising drugs targeting Alzheimer's have failed in costly late-stage clinical trials. For example, Biogen's Aduhelm faced setbacks due to limited efficacy and high costs, causing debates about treatment accessibility. These failures highlight that scientific discovery alone is not enough. The complexity of Alzheimer's pathology means treatments must be part of a broader strategy that includes early diagnosis, patient care, and social support systems to improve outcomes. To accelerate progress, governments worldwide are boosting funding for Alzheimer's research and care infrastructure. The U.S. government recently increased its Alzheimer's research budget to over $4 billion annually. However, funding alone won't solve the crisis. New policies need to support early screening programs, caregiver training, and affordable treatment access. Without coordinated policy efforts, scientific breakthroughs risk being out of reach for many patients and their families. Informal caregivers, often family members, deliver about 80% of dementia care. Yet many face emotional, financial, and physical strain without adequate support. Experts argue that supporting caregivers through education, respite care, and financial assistance is as crucial as developing new drugs. Communities and health systems must evolve to provide these resources, helping caregivers sustain their vital role in managing Alzheimer's at home. The next Alzheimer's breakthrough will come from combining scientific advances with effective policies and community-based solutions. Companies like Eli Lilly are exploring multi-target therapies, while governments expand screening programs. Meanwhile, nonprofits push for caregiver support networks. This multi-pronged approach acknowledges that ending Alzheimer's isn't just about science. It's about building systems that support patients and families throughout the disease journey. Alzheimer's is not just a medical challenge, it's a societal one that affects millions of families. Understanding that science alone won't solve it means you can advocate for better policies and support systems in your community. Stay informed to protect yourself and loved ones. For more updates on health breakthroughs and what they mean for you, subscribe now.